Is mold making you sick? Could it be the cause of your mystery autoimmune disease? Well, it was for me, and some experts estimate that 20% of the population could be struggling with mold toxicity and not even realize it. I recently figured out that mold was the cause of my chronic illness that I've been struggling with for the past 4 years, and I'm currently on an extensive treatment plan to get better. If you're new here, I have a degree in science and I enjoy doing research on topics and reporting them.
Planet Me podcast.
This is the journey of setting yourself free.
Treatment for CIRS and mold toxicity. So the first thing I'm going to talk about is the Shoemaker Protocol. So the Shoemaker Protocol is a medical framework developed by Dr. Richie Shoemaker for treating CIRS and mold toxicity. Based in the United States, he began his research after identifying a link between mold exposure and chronic illness in patients. He's responsible for progressing the field with publishing several scientific studies on the topic, which I've put some in my blog. The protocol focuses on identifying and addressing the root cause of inflammation with a step-by-step process, which I'll go through now. Please note that not every doctor will follow the protocol exactly, and treatment plan will differ per individual. So please also note that the timeframe for healing from mold varies dramatically per person, depending on how badly you were exposed and how sensitive you are. So the timeframe given is often between 6 months to 5 years, and some people report never returning to full health. However, it is hard to know if these people were ever truly removed from the moldy environment. But in general, there is hope. CIRS really is treatable, and yeah, you can get hope of getting your health back eventually. So the following information is taken directly from Dr. Shoemaker's website, survivingmold.com. 1. Removal from ongoing exposure. So obviously this means the first thing you've got to do is get out of the moldy environment. Now this is easier said than done, as first it can be hard to pinpoint exactly where is the mold coming from. Is it coming from your home? Is it coming from work? Is it coming from school? And if it is coming from your home, how do you break a lease? Where do you go? A lot of people don't have simple answers to these questions. So first you got to pinpoint it and then get out of there. I moved into a tent in my parents' backyard and that's working really well for me. So yeah. Step 2, treat with cholestyramine or other binders. So I'm going to go into the binders now. So the main way to treat mold illness is with binder medication. So as mentioned earlier, if you have CIRS, your immune system can't remove mycotoxins. It will try to remove them through bile, which it releases into the intestines, but it will get reabsorbed into your body through the digestive tract. So the binders work by binding to the toxin more strongly than the toxin binds to bile. And so then it is excreted via stool. So this is why it's important to ensure that you're maintaining regular bowel movements while you're taking binders, because if you're not excreting it, it can cause the toxins to reabsorb into your body. There are many different binders that you can use, but the best one is a prescription called cholestyramine. It is often used to lower cholesterol, but it is considered the best binder because it's similar size and the opposite charge to the toxins, causing it to bind really well with it. However, as I said earlier, different mycotoxins can bind best with different binders. So there are some natural binders, such as activated charcoal, clay, and I even know someone who's used steamed kale as a binder. But I just went straight to the hard stuff. I really want to just get this out of my body. So I use Question Light, which is still cholestyramine, but with different fillers. And this version is significantly cheaper than the compound or pure version of cholestyramine. Question Light is $44 for a pack of 50 sachets in Australia, while the compound version is roughly $300. So for those who don't know, a compound pharmacy is where they have a lab at the pharmacy and they make the drug in the lab on site. And so this is why it's a bit more expensive. But some people are really sensitive and they can't handle the fillers that are in Question Light, so they have to get the compound version. Mold toxicity is really closely linked to multiple chemical sensitivity. So it's actually really common for patients of mold toxicity to be extremely sensitive to medications. And so it's not uncommon for people to have to start with 1/16th of the normal dose or even less. Dr. Neil Nathan talks about this a lot in his book Toxic. So really recommend that if that's you. Other people also are a bit iffy with Question Light because it contains the sweetener aspartame, which some speculate is associated with cancer. So I'm actually taking a mixture of 3 binders. I'm taking cholestyramine, clay, and one that's from a brand called Cellcore. However, be careful with anything you take, as citric acid is often derived from black mold and is in a lot of products, so you have to be really careful. Okay, so reactions. It's actually really common for people to have really bad symptoms when taking binders. So if a reaction appears to be an exacerbation of your current symptoms, it indicates that the binder has pulled the toxins into your body faster than the compromised detoxification systems can clear them. So basically what this means is that the binders are gone into your body, they're taking the toxins out of your system and they're bringing them up to the surface to excrete them. However, sometimes we have blocked detox pathways, and so they can't get out, and this causes you to have a heap of symptoms. Pushing through this does not make you heal faster. It's really bad to push through things. It'll make things worse and set you back. So if you're taking binders and you're having bad symptoms, back off, back off the dose. I'm going to go into detox pathways. So, binding is only half the story, because once the binders pull the toxins out of your system, you then have to detox them out of your body. However, the toxins themselves often poison the very systems needed to remove these toxins, such as the lymphatic, the kidneys, etc. So as a result, it's really common for mold patients to have reactions to binders, as the medication brings these toxins to the surface, but they have no place to go. So it's really important for patients to optimize the drainage pathways. The best way to do this is to sweat. So exercise is good if tolerated, and so is going to the sauna. So I'm currently going to the sauna somewhere between 3 to 5 times a week. Other methods include dry brushing and rebound trampolining, which is just jumping on a little trampoline every day, as these will stimulate the lymphatic drainage system. So, I did experience this. I experienced really, really bad flare ups of chronic fatigue, and they just left me absolutely bedridden and worse than I've had in years. And also some pretty bad bouts of depression. And it was pretty scary, to be honest. It's like I had a mental flashback of where I was at that place. So for me, my mistake was I increased my binder dose too quickly. I started on half a sachet in the morning and half at night. Then I quickly went up to like one in the morning, one at night, one and a half, two, two and a half, three, which is like six in total. And it was just way too much. It was silly. I did all that in like a week. So, but I'm pretty headstrong sometimes. I'm like, I just want to get better. Yeah, big mistake. Okay, so step 3, treat mark-ons. So mark-ons are a group of bacteria that can colonize in the nasal passages, and they're often resistant to antibiotic use. So they're very common in people with more toxicity, and they actually contribute to worsening the symptoms. They can cause an increase in cytokines in the body. So this worsens the immune response, it destroys MSH function, and they make thick layers of biofilm, which protect the bacteria, which means it's hard for you to actually get them and get them out of your body. So the presence of mark-ons is detected through a nasal swab test, which is $200 in Australia through Nutripath. It's one of those tests where they, put the swab right at the back of your brain and like tickle it. I tested positive with a quote severe overgrowth, and that explains why I can't breathe through my nostrils and have to mouth breathe at night, from my understanding. So my treatment protocol includes saline irrigation daily, and now I do that flush with a herbal solution as well. And if it's still present after 8 weeks, I will have to try antibiotics if I can. Okay, so the next steps, 4 to 11, I'm actually just going to skip them because they're really technical and I actually can't pretend that I fully understand them. But basically, I have the information on my blog though, if you do want more detail. But basically, mold will disrupt all these different systems in your body. And basically, steps 4 to 11 is you treating these individual systems. And, there's easy markers that you can do blood tests for to actually see how they've been affected, which is how you can get diagnosed, and how you are responding to treatment. So, this includes correct anti-gliadin antibodies, correct androgen levels, which is the sex hormones, which is how mold affects your hormones, correct ADH. So this is why people get a lot of static shocks when they have more toxicities, because there's a problem with like the osmosis with like your, I think it's like your electrolytes or your ions with your water. So, there's dysregulation in that, which is really interesting. Correct MMP-9 levels, correct VEGF, correct C3A, correct C4A, TGFB1, and BIP. Sorry, there's 12 steps. So, and a lot of these steps are really interestingly related to fatigue. So I'm excited to go through these steps.